If you are using the Medicare.gov Find a Medigap Policy tool or quote engine, uh, this is for you because you are looking into your supplemental coverage. And the way you do it is start by typing in your zip code. And then from there, it'll give you step one, decide which plan you want, and supplemental insurance, also known as Medigap, plans in, and then whatever zip code you put for the state, it'll put your state. I happen to be in South Carolina, which is a very good market for Medicare supplemental insurance. And so you put in your age, your current age. And so this is really meant for people that not only are turning 65, but if you are anywhere in your upper 60s to mid 70s and you're computer savvy, this is actually going to give you a better idea of what the marketplace looks like in your area for Medicare supplement insurance premiums. And it's very important because they do go up over time in 3 different ways. But let's move on with the quote engine. And this is the same data that's pulled from the CSG Actuarial, which helps out all the Medicare insurance brokers out there. So it will give you a range, but it won't give you a specific granular company by company, plan by plan, side by side comparison. And I've talked about that in the past. So it's somewhat of a service issue, but it could be coming your way as a Medicare beneficiary for you to gain more information on a marketplace for your Medicare supplement insurance. So you just pick the gender here. Then after that, pick whether you use tobacco products or not. This is something where, yes, you do get charged more if you click yes, and typically if you click no, the premiums are less. And that's always been a characterization or attribute of all quoting tools for healthcare in the United States, as well as the male and female. You'll typically get higher rates for Medicare supplements for men because they don't go to the doctors as often, or and then for a female, the rates are typically lower. And I'm talking about in general. And then for this market, South Carolina, that's how it's going to look as well. So you just update, press update here, or it'll already update if you change it. But it'll go from A to Z, and so typically a lot of folks like to go from lowest to highest. And so if you look at Medicare supplement plans and the Medicare New Handbook in your choosing a Medigap policy booklet as well, you'll find that the high deductible plans, which are not that high deductible because the deductible is met after $2,490 for 2020, and so that's up from $2,370 from 2021. And so as you can see, it ranges from $35 to $77, but it does not show you company by company, side by side, to show you the actual availability of the plan in the state of South Carolina. So it does go over the co-pays and co-insurance, and there is no co-pays generally that are approved by Part B services. But then again, you have to pay for the $2,490 part. $90 deductible, I should say. And this is generally met if you have services, medical services and supplies that equate that number, right? So some folks might hit that $2,490 in a year, or in like less than a year. But just note that for the most part, it's tailored to where you're utilizing the plan. You're utilizing the high deductible plan. So this happens to be high deductible plan F, and there's no discernible difference between high deductible plan F and plan G if you look at the YouTube videos comparing the two out there in the internet. Okay, so your max out of pocket would be $2,490, and then obviously your plan would kick in for catastrophic coverage, where you had to go in the hospital for multiple days. You had to choose. Your providers had to, get you to use one of the higher claims medical services out there, like having surgeries or treatments or cancer treatments or anything to that effect, where it's inpatient or Part B outpatient, like a surgery or something like that. Okay, so you still get the same benefits as the rest of the standardized Medigap plans. Skilled nursing facility, Part A deductible, Part B deductible, Part B excess charges, foreign travel that's not really used because nobody uses it for that. Medigap plans for that. So as you can see here, you're for $35 to $77. It's kind of smart for you to, especially if you're healthy and you don't use the hospital, you don't use the medical services very often. It's very low premium, but I will say that you have the variability of never knowing when you have to fork out the $2,490, and so that is your your variable that you'll have to consider. Okay, so moving on to Plan G, high deductible. As I said again, if you can clearly see there's no premium difference in range, 35 to 77, and this is for this particular instance, 66-year-old male, non-tobacco user, and such. And so with the Plan G high deductible, 2,490, but there's information on the internet about the 233 Part B deductible. It is encapsulated in your deductible. As you can clearly see, it doesn't say Part A or Part B. Look, it says Part A is 0, but then look, Part B is 233. But from what the folks on YouTube, the experts are saying on YouTube, when you compare the two and you look at the actual paperwork and look at the actual verbiage, there is no discernible difference in MOOP when it comes to high deductible Plan F or high deductible Plan G, and there's no discernible difference in premium as well, as you can clearly see. So alright, so Plan K nobody gets, Plan L nobody gets, Plan N they do have a lot more folks coming on to Plan N, especially for the folks that don't want to really worry about a $2,000, $2,400, almost $2,500 possible bill coming in the mail, but they do want to be able to have access to the same providers because Medicare A and B is their primary. So Plan N is gaining a lot of popularity, and as you can clearly see, look at this. If you're paying $77 anyway for a high deductible plan, look at this. You can pay as low as $76. I've had it. This is not totally accurate because it doesn't take into account household discounts and maybe some other discounts that are available through some of the companies as well. So and this is for a male, and then look all the way up to $411, and the $411 is really the books of business that have been on the books for a long time, and so you're not going to see that rate out there in the marketplace. And if somebody shows you that rate, they're obviously trying to get a big fat commission. So $76 still really affordable. If you look at the plan details, look, it does have skilled nursing facility, Part A deductible, that's the hospital, so that's the hospital deductible that's met per occurrence. And then what you, the beneficiary or policyholder, need to be aware about is your cost sharing. So that's the Part B annual deductible, which is $233 for 2022, and then Part B excess charges, and that's typically if someone does not accept assignment for Medicare, or accept full payment from Medicare, and so those providers actually have to do an extra billing step and ask for money from the patient. And we've done many videos telling folks and beneficiaries out there that doctors do not like to ask for claims payment up front, especially for some big surgeries. Some providers have done that, but that's not how you, the Medicare beneficiary, should operate. You should let the providers bill Medicare A and B, and then they automatically and electronically file it with any supplemental insurance company, because it is transferred, it is sent over automatically and done by law to any supplemental insurance company and plan that you may have. So this is a Plan N, and so what I'm telling you here is that it's been gaining a lot of popularity. It's been very affordable. Don't pay attention to this $411 because obviously most folks are going to go for market value, which is right around $76 to $84. All right, if you go to Plan A, nope, nobody's taking Plan A in South Carolina or any place that I know of. Plan N, nope. Plan G, they are promoting this a lot in the marketing, especially with the big box brand names. We have a lot of folks that are still on Plan G, are happy with Plan G, but you do see the premiums go up. So the premium is in South Carolina can start at $102 for a male age 66, and then $435. But again, those books of businesses that are $435 or $300, if someone is still licensed to be able to sell that, they should not be in the business, because obviously you're going to shop around. Okay, and again, this does not reflect household discounts, and it doesn't reflect that if you are looking at these rates, but then you have a Plan G and your rate's higher, it doesn't reflect that if you can qualify, because most people know that you have to go through underwriting to qualify if you're outside of your initial enrollment or special election period when getting off group health insurance. So anyhow, on Plan G, everything stays the same, except look at this. So if you do have someone that a provider, say a OT that doesn't accept full participation or full payment from Medicare, typically, that could be anywhere from 10 to 15, 20, maybe $50. There's nothing in there's not been a very big there's not been an instance that I know about that Part B excess charge has been catastrophic. It's up to 15% above what Medicare has paid them. So that's not very big, especially if you're talking about something where they pay the PT or the OT like a $28 charge or a $98 charge or claim, I should say. Okay, so Plan B, nope, nobody takes that. No, it's not popular at all. As you can see, look, no skilled nursing, no Part B deductible coverage, no Part B excess, no foreign. So, all it has is hospital. So that's not covering very much if you're just covering hospital. Okay, so Plan D, I have heard a number of folks get onto Plan D. It's not popular in the state of South Carolina. It is popular. I'm not popular, but it is sold though. So, but in this particular instance, I wouldn't recommend it for this person that's in the state of South Carolina. And Plan C, that's a first payer plan. And first payer plans, it will tell you right up here that this plan isn't available if you turn 65 on or after January 1st. And to some people under 65. So literally Plan C and Plan F have to follow the macro law, which was which first started January 1st, 2020. And so obviously we're in 2022, and so this plan is not available if you turn 65 on or after January 1st, 2020. Some folks might want to have Plan F, but it's not very popular because Plan I'm sorry, not Plan F, Plan C, but it's not very popular because Plan F was been marketed to many folks as the Cadillac plan. So there's not a whole lot of companies out there, big books of business with Plan C. All right, the Cadillac plan is what they used to call this plan. Literally, that's what it was touted as. And again, it's a first payer plan, which means it's first dollar coverage. It covers, look, it covers the Part A and Part B for right here, Part A and Part B deductible. So you have no out of pocket. That's why many folks that still have Plan F love Plan F. It's still going up in premium. Thank goodness South Carolina is a market where the rates are still low, even if you're on Plan F, like 129. I've saved a lot of folks that are on Plan F that wish to stick with Plan F and it can afford Plan F, thousands and thousands of dollars because their premiums have gone up. Whether they are on their plan for a duration of 2, 5, 6, 10 plus years, their premiums were always going up, but they always paid their premium on time because they wanted to have the full coverage. So as you can see, look at the benefits: skilled nursing facility, Part A deductible, Part B deductible, Part B excess charges. Foreign travel is not really a factor. A lot of people ask about that, but you just get foreign travelers insurance, travel insurance when you go abroad, because it'd be really hard for you to submit that claim to Medicare A and B when the providers in Europe do not accept payment for the medical services over there by the U.S. government. Okay, so that's pretty much it in a nutshell, y'all. If you have questions about looking up more information about the Medigap policies in your area, if you want a more granular look, a side-by-side look, then we can do that here. I've done videos in the past, case studies where it shows rate reductions. I'm talking about from anywhere from $30, $40, $20 all the way up to $50, $60, $80, $120, $150 plus, reducing them on the same exact coverage that they have because these Medigap plans are standardized. So if you want more information on rate reduction service, then you just type in medicaresavings.us, and that's when you can do a pre-screen with us because we are independent and we know the underwriting qualifications for Medicare beneficiaries. You just go down to did your supplemental or your Medigap insurance rate go up again, and then just contact us from there. And then from there, we'd love to get in touch with you in terms of making sure that you're in the best place possible moving forward. Each market is different. Each market has different companies and rates, and some markets play a lot more rate games than others. So if you want to know more about that, please give us a call so that way you can know the facts as a smart Medicare consumer. Thank you for watching. God bless.